Bismillahirrahmanirrahim. Welcome to Medical Globe e-learning. This is Muzdalim from Shahid Aslam Medical College. So now today's our topic is gluteal and posterior thigh region. First of all, seat stores. Here are 7 MCQ and 2 SCQ from gluteal region. And this one highlighted with yellow, it is the location of gluteal region and important for MCQ point of view. Then move on to the next page. Here is the gluteal ligament. It is important for SCQ point of view. You have to know the names of ligaments and their attachment. Next one is the muscles of gluteal region. You have to know about the superficial layer and deep layer of the gluteal muscles. Then this diagram is important to see the ligaments of gluteal region and their attachment. Now next one is the table. It is important for SCQ point of view. These are the abductors and rotators of thigh. You have to know all the muscles named. It is also important for MCQ and Viva point of view, their attachment, their innervation and their action. Now here are the detail of all the muscles. You have to read it for MCQ point of view. Some important points are highlighted with yellow. This one. And next SCQ is the gluteal bursa. It is also important. You have to know about all the bursas name and their location. Next, gluteus minimus medius. You just have to read these highlighted points. Tensor fascial lata, it is important for MCQ point of view. Next, here are some important MCQs highlighted with yellow. Then piriformis. You have to know that piriformis, it is the location landmark of gluteal region and its nerve supply and blood supply. Obtuse internus and Gemini obtuse externus quadratus families. You just have to read it for MCQ point of view. Next our topic is posterior thigh region, and this table is important to see the extensors of hip and flexors of knee. It is important for MCQ and SCQ point of view. Here are SCQ about hamstrings muscles. You have to know about hamstrings muscles and their attachments. And then semitendinosus, semimembrances. You have to know that semimembrances give rise to oblique popliteal ligament. This one. It is important for MCQ point of view. Biceps femoris. You have to know about all its heads and its attachment and their action. Next, this table is important to see the nerves of gluteal and posterior thigh region. You have to know their origin, courses, and distribution. This one. Gluteal nerve, superior gluteal inferior. You have to read it, and sciatic nerve is important for UQ point of view. It is very important. You have to know its origin, courses, and its branches. Now, posterior cutaneous nerve of thigh is also important for SCQ point of view. Arteries of gluteal region. You have to know about trochanteric and cruciate anastomosis from BD. Here, just have to read all these arteries for explanation and for MCQ point of view. This table is also important for MCQ point of view. Veins are not as such important. Lymphatics, it is important for MCQ point of view and also for SCQ. Then here are some important MCQs highlighted with yellow from surface anatomy. This one and this one. Next, we move on to the clinical box. First of all, here are trochanteric bursitis, ischal bursitis. Both are important for SCQ point of view. Then on the next page, here are hamstring injuries, which is also important for SCQ point of view. Injury to superior gluteal nerve, also important for clinical point of view. Then an injury to sciatic nerve, it is also important for clinical point of view. Move on to the next page. Oh, the chapter is end. Hope so you can understand. For better preparation of prof, you can avail services from Medical Globe book MBBS cracks. Thank you. Allah Hafiz.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and supply solved university questions to ace your vivas, chapter polls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks, encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and the MBBS cracks at your doorstep by placing your order at 0335 66 33007.